And pronounce your last name one time for me, please.
Lamoureux.
Lamoureux. Okay.
Yeah, Lamoureux. I get all kinds of pronunciations.
I just want to make sure, because I don't hear it in my head right. It's going to be done forever. Forever. Here's another video from Chiropractic in Upland. I'm Dr. Tony again. This is Kelly Lamoureux, and she has a lot of credentials of dancing. She was 5 years old. Had a great scholarship, but I've been told from some of the parents, I'm up in Toronto, Canada, was it correct?
With the National Ballet School.
National Ballet School, and that allowed her to really learn a lot, I'm assuming, of what you're doing, what you've done in the past with ballet.
Right, right.
Okay. And now that you've had that experience, you're working with students now as a Pilates instructor, how does that benefit them as you being a teacher? We talk about conditioning and working with scoliosis patients.
Well, with their ballet training, a lot of the students that I work with, I also teach ballet lessons too in the group setting. And so I get to see them one-on-one in here and give them very specific movement. You know, if their spine is curved this way, you know, we're doing some.
And you're catching them at 7, 8, 9 years old, or what? How?
Yeah, we try to catch them early. The youngest, it's very recent that we've been starting to work with the girls scoliosis wise, but 11 years old, 10, 11 years old, and so I get to work with them in here and then see them and get feedback from their teachers on how they're working in their ballet lessons too, and how they're applying the work we're doing in here to their functional ballet movement.
When you talk about working with your students, how do you assess them naturally, or what do you do for that?
As far as their first session
Yes.
in here, so when I'm working with them, I have a little checklist I go through head to toe and kind of see how they're standing on their feet, if they're rolling in, if they have hyperextension, looking at the pelvis to see if it's rotated or if one hip's higher than the other, which is, you know, a scoliosis, you'll see that. Shoulders, you'll notice one shoulder higher than the other, and then maybe how the placement of their head is. So looking at them from a side angle, front angle, back angle, maybe you notice that their scapula, their shoulder blades are winging or sticking out. And then looking at them, you know, from all those angles and just seeing how they're holding their posture.
And also I like that you look at their hips, their knees, and feet also. So the combination from the ground up, the overall body can actually adapt and change the scoliosis over time. People may not look at that.
Right.
When you talk to your students and their parents, and when they take them to their medical doctor for an examination and or x-rays, are you getting a lot of feedback that way in cooperation with the medical doctor, or is it kind of on your own to do things to help correct it with your students?
Pretty much, I mean, the parents have had to be very, very much advocates for their children, and I kind of, you know, give them feedback on maybe questions to ask. When the doctor's looking at them, they're primarily with the scoliosis. A lot of times they just look at that one section of the back or the pelvis, so they're not looking at their foundation, their feet, their knees, their ankles, which can, of course, if you strengthen those areas and the way that they're standing, it can kind of work its way up through the whole body. So.
There's different signs you can see through the body that may give you a one thing to take the x-ray with, but maybe some rotation here so it can go from anywhere in the body.
Exactly, right.
And I like that you do it when you're training too. I've seen your last student, how you work with their whole body and have almost a visual in their head what their scoliosis looks like.
Yeah.
So when you set them up, it seemed like you would focus on the neck, the mid-back, the shoulders, the arms, the legs, the knee, the rotation component, the lateral bending, the hip elevation or depression for one too. So I like how you do all of that. How do you keep track of everything in your head? How do you focus on that? How do you do that?
Well, I'm working with 5 different girls
Yes.
with 5 different, some of them are similar. A lot of them I notice are like a reverse S.
Yes.
So a lot of them I'm having them, because they're curved this way, do side bending, you know, to stretch those tighter muscles here. And then I work with a girl that's opposite. So I draw these little diagrams, pelvis and spine. I review my notes before I work with them. But once, like some of the girls I've been working with for almost a year, it's really easy to kind of, and you can see it. When I get them on the table and I start working with them, I can see, okay, their ribs are rotated this way. And then I kind of remind them and ask them questions. Okay, which side do you have to rotate towards? And just to keep it fresh in their heads. And when their moms are in here, having their moms look at them and notice different things that are going on in their bodies so that they can work with their child at home.
And the one student you've worked with for a year, what kind of results have you seen so far with that student?
has wonderful awareness of her alignment. She's really standing tall. She is, I mean, she's working on it in her ballet lessons too. But there's almost no visible rotation in her spine. So I think the Pilates has helped her a lot. She's been to osteopaths and chiropractors as well, which has supplemented the Pilates work, which is great. And then her mom works with her diligently at home on her exercises, so she has a little home program.
Did she have follow-up x-rays yet too with that student, or was it somebody else?
Yeah, she has, that was the student that has been in, and about every 6 months or so they do an in-brace x-ray and then they do an out-of-brace x-ray, and they're really happy with the results so far. And
she's had probably a growth spurt since then
too. She's had quite a bit of growth.
And it seems like when they have a growth spurt, it almost gets out of whack for a while. It can come back and play if you're diligent to stay on top of the exercise, the routine, and really follow up on that too.
Exactly, that's the main thing, and just parents being aware.
And you mentioned too earlier, you give them home exercises to do, an exercise program. How does that work?
So I work with them in here, and then I show them exercises in here that they're able to do at home, because we work in here on different apparatus, spring tension resistance, but then I apply, they'll use TheraBands at home or foam rollers at home, and I kind of give them a very specific home program working on all kinds of different ways of bending the spine. So forward bending, extension of the spine, so they work on really strengthening those muscles, and then side bending, stretching and strengthening exercises.
Great, great. And why has the program here have more scoliosis, I guess, dancers, or is it just there's more of awareness for that?
I think there's more awareness, and like I said, in the ballet training, a teacher can really see very well, you know, is a student leaning to one side? Why is their shoulder higher? And you should probably, you know, talk to the parents. You should probably go get your child checked and x-rayed to make sure that, you know, we can get this, kind of nip it in the bud before it gets worse.
And we talked about earlier too, what's a good message for parents to understand to check their children? Is it more in here, more the medical doctor, more the chiropractor, more an osteopath? What do you think seems to be the best, I guess, perspective? I know you do the assessment with them also. Is there something where there's a standard out there yet, or is it kind of up to the parent what they want to do?
The parents, I think the first thing they usually do is go to their primary care physician. They'll get some x-rays. They might be referred to a chiropractor, or if the parent has been going to a chiropractor, I noticed that they'll bring their child and say, can you do some x-rays? Can you do a little assessment? And then from there, a lot of times the child is also working with you know, either an osteopath or a lot of times a chiropractor, in addition to doing the Pilates work, to kind of supplement that.
And that's part of it too, is the integrating that program of synergistically, where you see a chiropractor, a Pilates instructor, get the x-rays done, get everything done, so you are on top of it as a parent, especially to make sure your child is being checked all the time.
Exactly.
And sometimes our young adults and children, they don't feel pain. They may feel great.
Right.
So they're gonna think they're not sick, they don't have a problem. As a parent, you have to go, I think sometimes be more proactive and go, even if your doctor says we don't need x-rays right now, go, we'll just take an x-ray just in case.
Exactly.
Let's make sure we're not missing anything. Let's take things, rule things out, versus wait till there is a problem, we catch the ghost where it might be too late, where we need to do the bracing and the surgery, where now we've gone down a bad path to where we may not recover back to 100%.
Exactly. So catching it early is key, and just keeping parents aware. You know, the first thing you can notice is your child's, you know, shoulder high. How are they sitting? Are they sitting on one leg all the time? You know, and if you're noticing things like that, get it checked.
And part of what we're going to do is add to the video of this at the bottom description is one of the assessments we've done in the past, where kind of get the parents know this is what you should be looking for in general.
Right.
Okay. Any question, you can always give our office a call. I'll send Kelly's information over too. The biggest thing is, how do we make us as parents too more aware of what we can do to help our children, because we are really a health advocate. We should be their number one, not their doctor, not their chiropractor, no one else. It's up to us.
Right.
So that's really it.
Great. Thank you.
Thank you. All right.
Thanks.
Thank you. That's part of it too, just letting people know.
Yeah. No, I think it's great what you're doing, and